Mark, the president has indicated willingness to compromise on the government-controlled health care. Do you see that as a positive sign?
Well, most of us who have been opposing this don't trust him at this point, because he attacked the insurance companies, he attacked the doctors, he attacked the basic profit motive. The question is this trying to get their foot in the door? I believe that we have offered for years alternatives. We offered alternatives in committee. The Democratic leadership is rejecting those alternatives. There are a few things that we need to change in this system. I believe we need to address the pre-existing conditions. I believe we need to address catastrophic care. But those can be done through the private sector. The fact is, those are adaptations to the existing system. And he still, from what I heard yesterday, is proposing, from what I heard yesterday, that the federal government has to mandate at least conditions, that the federal government is going to have some kind of quasi-entity, whether it's what you call the single-payer direct government system or some kind of a front for that. And those premises are the kind of the camel's nose under the tent type of thing. So unless we see private sector-based compromises that build on our existing health system and fill the gaps, these are not real compromises, they're just different strategies to get federal health care.
Versus at Medicare rates, which we're making the assumption that it is going to be reimbursed at those rates. Number two is the financing for all of this. We've heard the numbers from $900 billion to $1.6 trillion over the next 10 years. Just a couple comments to make about that. This was a recent article from Newsweek that says Obama has also said that he has identified $2 billion being spent right now, but identified is the operative word. These savings are estimates, and whether around $650 million, about 2/3 of the cost of the health care reform over 10 years, can be saved remains to be seen. Most of the money will come from Medicare, but cuts in payments to insurers and practitioners aren't popular measures that easily move through Congress. One other.
If we don't vote, what I'd probably do is come in Thursday night or try to get here for a 9/11. So that's what it is. But if I'm there, I think that's what I told her. If I'm there, we were going to meet. But assuming we stay with that schedule, we should be able to.
Okay, that'd be great.
Yeah,
We got two presidents.
yeah, that's exciting.
Yeah, there'll be a couple people there. Do you have a card on how to get to?